COVID pandemic is, I think, absolutely unique scenario we are all undergoing currently, especially in the dynamic of getting new insights, new knowledge, new information. So it needs an absolutely continuous adaptation of everything according to what information we get. And in parallel, the pandemic changes kind of. And we have always to be in a maximum of preparedness to balance this out in a maximum of safety for all of us, for patients and staff members, and also keep going to treat on a high level of excellence life-threatening and incurable diseases like multiple myeloma. So what we did is that we tried to consequently continue all myeloma treatments under maximum of safety. So ask the patient to go in like kind of a sort of home quarantine, not to go out to get the food delivered, everything, to do a maximum of social distancing and protection. We stringently ask our patients for vaccination regarding influenza and pneumococcal bacteria to avoid like double infections. And we also continuously substitute patients at need with IVIGs. All high-dose chemotherapies with melphalan and autologous stem cell transplantation we performed in time for high-risk patients, patients with only PR after induction, or patients with toxicity under induction, patients with standard risk, and patients who had a VGPR or CR during induction with a high tolerability. We stretched a bit the induction treatment to 5 or 6 cycles before undergoing high-dose melphalan. Overall, we did a significant amount of high-dose melphalan treatments during the pandemic, and we had no COVID infection, we had no severe complications. We saw myeloma patients with COVID, we saw patients who went over with a very moderate disease, infectious disease with a few days of fever and cough. We lost also one patient in aplasia after a VDTP salvage regimen in a very severe and highly refractory myeloma situation with a refractoriness kind of over years against all the approved drugs. So we saw also in our patients the whole spectrum of COVID disease. So at the end, we are trying to keep on going, as we think that a controlled myeloma makes less immunosuppression than an uncontrolled myeloma, and that the disease, myeloma disease, needs a consequent and stringent treatment. However, we try to make a maximum of safety, of supportive care, and so far we see that these measures taken seem to be adequate, and we try to carefully review the recommendation of the international and national societies and share in parallel our experience.